Hi, welcome to our LinkedIn interview series called Healing Medicine, where we're talking to healthcare professionals who are reinventing the practice of medicine, the practice of pharmacy. And today we have a very special guest joining us, Dr. Claudine Holt, the embodied MD. Claudine, thank you so much for joining us.
Thank you. I'm really excited to be here talking with you today.
I think it's important that more healthcare professionals have these discussions around personal, professional development. How can we get back to the roots of giving care to people, of truly healing? So not a band-aid approach to medicine, but
Mhm.
looking at healing as a practice, an art form, really, that we get to express our gifts and that we are trained informally. But I think that part of what has happened throughout the COVID pandemic with the pressure on healthcare professionals, there's so much talk about burnout and about the challenges that healthcare providers are facing. So first, I kind of want to start off this interview getting to know you and getting to know what does healing mean to you?
Yeah, so for me, healing really takes place on a few different levels because, as human beings, we're not just, a physical body, but we are also an emotional body, we have a spiritual nature, so healing really encompasses sort of all of those parts. And as a physician, as someone in the medical field, we've been taught to really focus on the physical body and healing the physical body. But unfortunately, we often don't have time to look at those other factors. So the belief systems, the emotional health, the well-being, overall well-being. And so for me, healing really encompasses looking at the complete picture of a person, not just what the body is telling us in terms of signs and symptoms, but also what their thought system is, what their thoughts are telling us and what their emotions are telling us, because there's a lot of information that we can get from that as well. So that's my sort of definition of healing.
Yeah, and I agree with the current system, the way that we were trained, the very protocol based, evidence
Mhm.
based medicine is it addresses only one part of that, right? It addresses
Yeah.
the physical. So we understand the biochemistry, we understand the physiology, understand the pharmacokinetics of how the chemicals act when introduced into the body. But that doesn't account for things like, why does the placebo effect,
Exactly.
why is the power of belief in and intention in what the patient or what the provider, whoever the one doing the healing work is, brings into the conversation. So I'd love to hear a little bit of more about your background and your work. So tell me kind of how did you get into this, and what does it mean to be an embodied MD?
Yeah, so I am an occupational medicine physician. So that means that I take care of patients who are also workers. And so they may be exposed to different hazards on their job, maybe certain substances that they're exposed to, or they've been injured or hurt on the job, or they've developed an illness from the work that they do. So that's what I do as an occupational medicine physician. But then last year, with everything that was going on with the pandemic, I had already been, doing some coaching for a while, and I decided to really shift and start a practice focused on burnout, and specifically burnout in women who work in healthcare. And that really came out of my interest in occupational medicine, but also my interest in just women's health and emotional health. I discovered life coaching myself in 2013. That was actually when I first hired a life coach. And around that time, I was dealing with some issues. Burnout was one of them. And, life coaching really helped to give me the tools that I needed to sort of navigate those challenges as well. So that's sort of how I came into in coaching in general and personal development. But in terms of embodiment, I didn't learn about that probably until around, I'm going to say 2019 or so. And embodiment is sort of a deeper level of work where we're not working at the level of the mind and thoughts per se, even though I do mindset coaching as well. But we're really taking it into the body because our thoughts create our feelings, and our feelings are really just vibrations, emotions that we feel in our body, and that causes a physiological response. So oftentimes there's a disconnect between, what we're focused on in terms of our thoughts, and we haven't fully allowed ourselves to feel our feelings, process our emotions, especially those emotions that are more uncomfortable, more difficult, more challenging. So a lot of the work that I do, I had a session actually earlier today, but a lot of the work that I do is just helping women feel comfortable, feel safe, feel resourced to really just feel whatever they're feeling in that moment and just honor that. And just that act of being present, it's actually really simple, but just that act of being present is enough to really release a lot of the angst and all the things that are associated with trying to stuff down our emotions. So
I can see that. And we do host retreats, like weekend and week long retreats for female pharmacist
Mhm.
entrepreneurs. And part of, I think, the transformational work that comes out of that is just the space that it creates to allow yourself to feel those feelings. So, I give the example, we were doing a sound healing one night. And because this is a group of pharmacists, I kind of preface it with okay, sound healing, it's about the vibrational frequency of the bowls, and it can
Mhm.
correspond to the chakra energy centers in the body. And it kind of gave them a primer on sound therapy and sound healing, and it didn't really go into some of the experiences until later. And the relief and the tears, I think, were
Mhm.
even surprising for some people, that they just said, man, I just felt like I haven't taken a full deep breath in
Yeah.
so long.
Yeah.
And I see the work you're doing, and I think it's important to address burnout specifically. Women, in your opinion, do they tend to, I'm not sure, is it the because we never ask ourselves, should we? Is it a boundary issue? Where do you see, as far as blocks or limiting beliefs around being a woman, being a healthcare professional, and being able to kind of do it all and handle it all?
Yeah.
How do you work through those challenges?
I think there are a lot of layers to it. One being that as women in this time that we're living in, I think a lot of us have been raised to sort of think that being a woman or our femininity, so to speak, is like a negative, like it's a
Mhm.
weakness. And we've been sort of taught that the masculine is like the normal way, or it's the right way, or the good way. And it's not about making the masculine wrong. It's just that's just kind of the way it is. Society sort of elevates the masculine as normal, and by default, the feminine is sort of abnormal, right? So a lot of us are disconnected from the very things that make us a woman, from our very essence, our very nature. And part of the reason why we're burned out is because we are not functioning from our natural state most of the time. We're trying to do things in a way that is a bit unnatural for us, right? And so that, of course, contributes to burnout. A lot of us also have these thoughts about, our value and our worth, and that it really comes from how much we can produce. So we almost become more of a commodity.
Mm.
And instead of allowing ourselves to just bring our natural gifts to what we do in our profession, we're focused on an outcome, we're focused on a result. And so, of course, that again is going to contribute to burnout if we're so focused on metrics and performance and, getting the outcome versus just being in the moment. Taking that time and space, even with our patients, is something that patients actually crave. They just
Yes.
want, yeah, they just want you to say, how are you? How's your family? What's going on in your life? And unfortunately, in a lot of practices, I know it's not that way with my practice. Fortunately, I do have that space to be able to have those conversations. But for a lot of practices, you don't really have the time to do that. So it's about getting it done as much as you can in that limited time that you have to spend with the patient. And unfortunately, that cuts out a lot of that sort of personal connection time. But as women, we're naturally connectors. Like, we like relationships, we like to talk and all those things. And I think for a lot of us, there's definitely lack of boundaries. There's lack of clarity, lack of self-connection. It comes down to certain skill sets too, maybe time management issues as well. But ultimately, it's kind of all of those things that are playing a role in why women, and we know the stats show that women are more burned out than men, at least in the medical field, which is sort of my area. But I think all of that contributes. And to add on another layer to that is a lot of women, if you're a wife, if you're a mom, your job doesn't end at work. You really do come home and you have that kind of that second job. So all of that sort of compounds to the result of women, experiencing burnout.
Yeah. Yeah. And that's what self-care can give us, is giving yourself what you have not received maybe from anyone else all day long, because we feel we're constantly giving to our patients and giving to
Yeah.
our families and giving and giving and giving. And so that's why it's so important to create this space,
Yes.
and then figure out, because of all those layers, is there something that's holding us back from allowing ourselves to feel self-compassion, self-forgiveness, self-love, self-worth,
Mm-hmm.
big, big, heavy topics, and getting into that. I love what you said about the commoditization, because I've seen this happen in pharmacy. We are so closely tied to dispensing of a medication,
Mm-hmm.
which is very backwards from the way most pharmacists, if you really talk to them, are pretty open-minded as far as using herbal treatments and focusing
Yeah.
on nutrition and plant-based eating, and using um, things like sound healing, and they're very open to some of that. So part of the reason behind this healing medicine newsletter is to start conversations between healthcare professionals about
Mm-hmm.
the types of holistic, complementary, and alternative medicines that are working for us in our lives, and figuring out how do we integrate that into our practices, into how we're showing up for our patients, because most pharmacists would rather help you get off of your medicines
Exactly.
than to see you on more. And I know physicians are the same way.
Yeah. Yeah. I mean, lifestyle, there's a field called lifestyle medicine, and,
Yes.
where you're trying to help patients see that a lot of chronic disease, I think the stat is like 80% of chronic disease is due to, lifestyle factors. And if
Yeah.
we can help patients to just mitigate those factors and make different decisions and different choices, they can really prevent those sort of long-term chronic effects. So, and I also think it's important, especially for us as healers, to be sort of the example and to lead by
Yes.
example for our patients. And for me, especially when it comes to like coaching and, the mindset work and the embodiment work together, I try to do that when I talk to my patients, when I counsel my patients. It's not just about, writing that prescription. Um, it's really about a more holistic approach, as you said.
Yeah, it's better choices, or making different choices, more empowered
More
choices.
empowered choices. I like that.
Yeah, and that, I think, by figuring out what the patient's motivation is, we were talking kind of before this about the Whole Health Institute and how I really believe in the vision of creating a more integrated care system that's really focused on true healing. So I'm I'm excited about the work that you do. I'm excited to be able to facilitate more of these conversations with healthcare professionals. So
Mhm.
how, if others want help beginning their healing journeys, beginning their embodiment journeys, and embodying the feminine and the healer, and I have a friend that calls me medicine woman, and I kind of love it secretly. So
Yeah.
like really seeing ourselves and thinking of ourselves in that way, how do you work with people to do that, and what's the best step to begin that journey?
Yeah, so I work with clients one-on-one exclusively at this time. So I work with clients over about 90 days, 12 weeks, and we really dive deep. The program is called Beyond Burnout because it really isn't just about burnout. Burnout might be, sort of the overarching issue that, a woman would come to me because, she's a woman in medicine and she is feeling burned out or overwhelmed because of work. But we really work through those deeper issues. So understanding the belief systems and the patterns of behavior that are contributing to her burnout. And then we dive deeper into those emotions, right? So those feelings from the past. It could be going back to childhood. It could be going back to even medical training. There's a lot of trauma that
Yes.
happens in becoming a doctor, a nurse practitioner, pharmacist. There is trauma. We don't tend to think of it in that way, because it's kind of like this, like it's just a rite of passage. Well, your attending went through it and their attending went through it, and so we just kind
Yes.
of keep passing down the trauma, right, through the generations. But it is trauma. So a lot of that stuff needs to be released, and a lot of it too is, again, our social conditioning as women. The way we've been taught to be a productive member of society, or what that looks like, that we're supposed to be this productive, member of society, and it's all
Hmm.
about what we're doing, again, instead of what we're being. So really unlearning all of that conditioning and really anchoring into the truth, what I believe is the truth of who we are as women, and like reconnecting with our feminine genius. And then that last phase is really when we start to recreate the environment. So that's when we work on the self-care, work on the boundaries, work on the charting and the time management and all of those like practical steps, but also sort of diving into the future vision. Like, what do you want your life
Yes.
overall to look like? Not just career, because that's important, but also your overall life, relationships, health, money, like all of it. So the best way to find me would be through my website.
And I will definitely link that in the show notes below so
Mhm.
that people can find you. So Claudine, thank you so much. It's
You.
wonderful to hear the work that you're doing and to be able to, openly have these conversations and start these conversations amongst healthcare professionals of what we see as being an opportunity to improve what I think we can all admittedly say is a system that is continuing to lead our population into sicker and sicker conditions. So I
Yeah.
think beginning to really ask the healers like what is going wrong in the healthcare system is a good
Yeah.
idea. So thank you for what you do, and if you're a healthcare professional watching this, I invite you to subscribe to the Healing Medicine newsletter. It comes out every other week on LinkedIn, and it gives you resources for personal and professional development and conversations just like this one. So Claudine, thank you so much for joining us
And
here
thank
on
you.
LinkedIn.
Thank you. I appreciate it. Nice to speak with you.